What's up, YouTube? Tonight we are covering all of the patients on the floor in the plastic surgery department and holding the hand consult pager. So you guys are coming with, because I think I'm gonna need some help. First things first, on-call essentials. Pen, notebook. I don't actually use it as much, but can't not have a pen and notebook. Bane of my existence, pager. Shears, cutting casts, cutting splints. And a backpack full of snacks. Took my son's goldfish. I would say these are my son's fruit snacks, but they're my fruit snacks. Beef jerky. Granola bar. Cookie from Figs. Shout out Figs. Oh, and most importantly, a Celsius that I'll be drinking at about 2 in the morning. Hi, this is JR with Plastics Returning a Page. So I just got a consult. A patient ended up smashing one of their fingers just at the distal phalanx, which is just kind of the last part, the last tip of the finger, and they had a tuft fracture, which is literally like the fingertip, the end of the fingertip fracture. So usually these are not kind of operatively managed. Usually you can put these patients in kind of an alumifoam splint or something like that and kind of let this heal with secondary intention and not having to kind of fixate the fracture fragments with a pin or something like that. Main things that I always think of when I go and I see a hand consult is, one, in terms of history. Is this person right-handed, left-handed? What do they do for work? Maybe more aggressive with providing treatment options in one case versus another. And then in terms of physical exam, always thinking about my neurovascular exam primarily. So making sure that the patient has sensation in the median, ulnar, radial nerve distributions, making sure the patient has adequate cap refill so I'm not concerned about any vascular damage. And then motor exam is also usually important. It's probably not going to be a factor in this case, but you know, there's kind of general things you can ask the patient to do. Make a thumbs up, do an okay sign, open the hands, close, make a fist, kind of those kind of general things, just to assess for motor function. And motor function can be out for multiple reasons. One, maybe a nerve problem, but also patients can have tendon injuries and, like the case of lacerations, things like that. So good neurovascular exam. And then I forgot another part of the history is, you know, always ask, especially if you're considering this patient for surgery, which I don't think I'm going to in this case, but is this patient smoking? Is this patient on blood thinners? Any kind of immunosuppressant therapy? Does the patient have diabetes? Things that could affect your operative management or healing following a procedure. So we're gonna go see how this patient is doing. Hopefully they're doing okay, and maybe we can just kind of put this bit of splints on this patient and hopefully get them home. So we'll see, and I'll follow up with you guys afterwards. All right, so that was not as smooth of a process as I was expecting. It ended up being an open fracture. So that changed things. And then we ended up getting like 3 more pages about new consults all at the same time. So I went down there at about 9 p.m. or so, and it's now 12:18 a.m. Call. But overall, I think it was a really, really good experience. So with the distal phalanx kind of open fracture, and by open, the only reason I say that it's open is because there technically was a wound. You couldn't like probe to any exposed bone or any exposed tendon or anything like that. So the wound was relatively superficial, but if you have a fracture underneath a wound that was bleeding, just by definition, that's an open fracture. And the patient had a terrible nail bed injury as well. So basically all we really had to do was wash the wound out, take the nail off, do a nail bed repair, and we ended up actually leaving the kind of small laceration that was the wound open to let it drain instead of closing it. You have to be very careful when you're closing wounds that are at risk for infection, because if you just close it, you're basically gonna get, the infection has nowhere to go but to the bone, and you don't want that. And so left it open, put a little tube gauze kind of dressing on it, which is like a super cool way of just dressing finger injuries. And then we had a distal ulna case, which was very simple. It was non-displaced, so basically all you do is throw a sugar tong splints on it, keep it pushing, so that was nice. And then we had a patient who had a cast on, got the cast wet, so basically just had to reapply a cast. But it was nice. It was nice to kind of like feel the sense of urgency of, I have all these things on my plate, I need to triage what's most important, let me figure out how I can get through these consults in an efficient way while also maintaining a sense of like presence with each patient that I'm in front of, so it doesn't seem like I'm rushing, so that they feel like they've been taken care of, not only physically but also just like emotionally. People in the ED are not having a good time, and so that was just, all those experiences are always great experiences, even though in the moment it seems like, oh my goodness, oh no, pager's beeping, no, you know, that kind of thing. So, and while we've been taking care of this, I'm with a senior resident who's a 4th year plastic surgery resident, also on hand call. So me and him are taking care of the hand call together, but he's also taking care of the plastics call. So he could have a consult related to something plastic surgery, and I can just kind of take care of the hand stuff. But I'm also taking care of all of the floor patients in the plastic surgery service. And so while we were down in the emergency department, I'm also getting paged about patients who their pain is not well controlled, or they're feeling nauseous or something. And, you know, then I have to call the nurse, see what the deal is, try to make a good plan on at least getting them overnight, because as the overnight resident, really all you're trying to do is just make sure everybody can make it to the morning, and then the day team will be able to kind of get things kind of squared away. And so really just managing pain, nausea, those kind of things is what I was doing. But yeah, it just adds a extra layer of complexity when you are dealing with like an open fracture and then someone's like nauseous on the floor and other stuff. So it's all good. Gonna finish up some of these notes and hopefully have some time to just chill, maybe do some ortho bullets, and see when the next consult comes. Almost 1:30. I have finished all of my notes for the consults that we saw. I am all caught up on pages for patients on the floor, and the emergency department is now looking a bit quiet in terms of any possible hand consults. So now I'm going to actually go down to the lab and do a little arthroscopic training. Most of you may know, some of you may know that I'm an orthopedic surgery intern, and I am very interested in sports medicine. So the opportunity to have a scope trainer, which we do in our mastery lab, is a huge blessing. So I want to take full advantage of that when I can, especially when there's kind of downtime when I'm on call. And we also have an amazing breakfast that starts at 2 a.m. I think. So definitely gonna see what that's talking about. They make fire omelets, so that's one of the reasons why, even if it's like 2 a.m. and nothing's going on, you just kind of gotta stay awake for the omelets. And it's about 3 in the morning. I finished my little omelet, came in and did another module on the Vertimed, which is that arthroscopic trainer. And I think the ED is going to stay quiet, and I think everyone on the floor is going to be tucked in for the night. So I think I'm going to go and just get about an hour and a half of sleep. You would be very, very surprised at the difference that an hour and a half of sleep can do on the rest of the nights for sure, but definitely on the next day. But this is truly what call looks like, at least what my experience with call has looked like so far, where there are moments where you are just running crazy, feeling like you can't keep up with the pages and the consults and don't know what to do with half of them and trying to figure it out. And there are also moments where it's like, oh, okay, it's quiet. I'm gonna get a little bit of some personal me time in. I'm listening to an Audible right now. I'm listening to A Man's Search for Meaning by Viktor Frankl. Amazing book. And, you know, it's like, okay, I'm technically on call. I always have a pager on me just in case, but it's quiet and I am listening to an audiobook, training my arthroscopic skills, fresh off of an omelet. So, you know, I think when people are highlighting how challenging residency is, and residency is ridiculously hard, it can be very easy to forget these moments of just, you know, peace and to myself. And yeah, it's crazy because it's 3 a.m. so most people are sleeping for sure, but and if I get a page in 15 minutes, I will be up and taking care of whatever is going on. But there are these moments too throughout the call shifts, throughout the days, and I think it's easy to forget. So it's been a nice kind of hour and a half or so to myself, and now I'm gonna try to go get another hour and a half of sleep. But you guys will always be coming along for the ride, so probably see you. Hopefully I'll see you in an hour and a half when I wake up and not in 30 minutes when I get a page, but we'll see. Almost got to close my eyes. Be like that. It'd be like that. We made it. Another call shift is behind us, and I actually was able to get like an hour and a half of sleep there. So that was an amazing call shift. I think the highlight was being able to learn how to do a nail bed repair. So I feel very confident being able to handle that kind of injury if I see it alone and have to manage it by myself. But it was a great shift, and it's always fun when I get to bring you guys along. So maybe I'll do that a little bit more often. But I hope that you guys enjoyed this video. If you did, make sure you like and subscribe. And of course, as always, keep evolving, and I'll see you guys in the next one.